Sam, I want to start with you because you and the folks at the Center for Economics and Business Research were behind this study, and $42 billion a year is the number that is lost in, or at least could be saved if we figure out how to handle this proactively. How did you do this study and come to that conclusion?
So the team at Bupa were particularly interested in understanding how people respond to certain big life moments and in the context of the workplace. So say if you're going through a divorce, if you're becoming a parent or a carer, how does that then translate into the workplace? Are you taking more time off? Are you still going to work but performing at less than your typical capacity? These are the types of channels we were looking at and ultimately we're looking to quantify.
It's significant. And listen, I hate to put things in dollars, but it's certainly what gets CEOs' attention. Sam, it's what gets, economies, leaders of countries, their attention. I mean, there was an impact. I feel like we've talked about this. Why was it important to do this particular study? What new light was shed for you?
Well, it ultimately puts a quite tangible cost to the impact of poor mental well-being, and in that sense, it's the most digestible way to understand what is quite a human and emotional phenomenon.
I think what's most interesting to me about this is the proactive approach, because and talking about mental health at work is nothing new, and workplaces, I think, at least in many parts of the United States, and in bigger companies that have the resources, are certainly seem like they're starting to take this seriously.
And I would say COVID really opened up this conversation.
Absolutely. Andrea, come on in here, because I'm curious about a proactive approach to mental health, and instead of a reactive approach. What does that mean?
It means normalizing it, right? We are all going to experience challenges with our mental health from time to time, and it's okay to talk about it. It means being aware that we're going to have these bumps in the road and identifying what tools you might use. That might be talking to friends, increasing exercise, looking at chatting to your GP even as the first port of call. But at Bupa, because we are setting up these mind place clinics across the globe, we really want to be part of that preventative conversation. And in Australia so far, we're finding that 50% of our patients that are coming through have never accessed mental health support before. So it's showing that even by putting these types of sites on foot, traffic available to the public means it's more accessible, and it's easier for people to feel like there is a place to go when they're even starting to feel some of these challenges.
Andrea, there's, making sure that there are places for people to go or to talk to, certainly one aspect. But I also think we still, as a society, corporate society, personal society, the support of having it, whether it's family, friends, those you work with, like that is also an important component to this.
Absolutely. Absolutely. And that's what I mean about normalizing it. We're all going to go through it at some stage. Even these examples that we looked at, losing a loved one, getting married, having a baby, or losing a baby even, right? We know how challenging those are because we've all been touched by it at some point. So it's okay, whether you're the CEO, whether you're an aged care worker, to actually feel like we can talk about it at work, we can take the time that we need, and we feel like our employer is going to support us. I mean, the research showed that globally, 1.7 billion days of work are lost each year.
Wow.
Because of this. That's staggering. So imagine if we were more proactive and we normalized it and we said, okay, you've got this life event coming up, and you talked to your staff about it and you prepared them and you gave them access to these types of services just to ensure they have a smooth transition in and out of these major life events.
Yeah, it's at 1.7 billion working days, $636 billion in lost productivity. Sam, come on back in here, because of the Center for Economics and Business Research. This is what you study. It's not easy to sort of implement change such as this across an organization, but based on the research that you've done, what would you say are the things that workplaces need to prioritize in order to, I mean, look, it's easy to make the economic argument here, but it's not easy to necessarily make the change in a workplace to figure this out?
I think the key conclusion there goes back to the point on being proactive. The research found that those who were proactive were able to return to work faster, suffered less of a productivity impact. So the main takeaway for business is that encouraging that proactivity, being an open workplace, is not just beneficial for the individual, but also for the organization, and indeed at scale for the economy as a whole.
One of the things, Sam, I'd love for you to just talk a little bit about how you guys did this survey and how it worked out and how you actually went about kind of grabbing the data or finding the data. Did you sit down with individuals? Was it companies? Like, tell me a little bit about the process. I'm curious about it.
Absolutely. So the survey was fielded to over 13,000 workers across several major markets. And we, first of all, asked these workers about the rate at which they experience these life events. And we find that of the life events considered in the study, around 10 to 15% of the population will experience any one of them in a given year. So it's quite a large share of people are going through this at any given time. And then amongst those who've had recent experience of those events, so divorce, marriage, bereavement, we then asked about what the impact channels were. We asked about emotional aspects, but then we also drilled down into the workplace too, whether they took time off, how long that was, whether they stayed in the workplace but underperformed, and how long they felt they underperformed for.
Wow.
Interesting. I want to ask you guys both something, though, and forgive me, and maybe it's just because we're into numbers here. So the global economy is, if you measure it through GDP, is about $126 trillion. So we're talking about $636 billion in lost productivity. I haven't done the percentage, but just a little perspective there. I'm not saying it's not important, but I do think, again,
it is less than 1%.
It is less than 1%. So I think, how do we think about that against other stress points? I feel like financial, like we talk so much about, the cost of housing, the cost of food. I don't know. Come on back in, Andrea, because, when you think about helping people, there's a lot that are coming at individuals.
Absolutely. So we have found even things like the cost of access to mental health is a barrier because of cost of living. We're looking at interest rate impact on how many people might come to our service. So we're looking at interesting ways to break down that barrier through low cost models. And fortunately in Australia, we have Medicare, which covers part of your access to mental health treatment. So how do we waive the out-of-pocket fee, for example? So we know that those types of stresses increase things like family breakdowns, defaulting on mortgages, and therefore may cause major life events.
I'm glad you brought up the policy differences in different countries, and I'm wondering, Andrea, if there is a way that you think governments, and it's sort of anathema to talk about here in the United States in this political environment, but if there's something that policymakers you think could do on a large scale to address this.
In Australia, we are really fortunate. We place a lot of focus on mental health. Our government has invested in public mental health services. As I said, they fund some of these services that our clinics deliver. And because this is a global project, and I've been fortunate to work with our European and UK colleagues on this, what I've identified is that in Australia, our funding is carried by the patient, whereas in a lot of those other countries, the funding sits with a contract that the provider must hold. And what that's meant for us in Australia is that the patient can choose their provider. They can choose whether to go to a not-for-profit or a private service like ours. They can choose whether to use all of their funding with us or part of it. So it's been a really interesting learning, and I've been sharing that with our European and UK colleagues in terms of some of that public policy advocacy. We're really lucky that we can get quite close to government here, being such a strong brand like Bupa, and we have regular conversations with them about what we're doing in these spaces across all of our health services, and they really listen. I was meeting with a chief of staff just last week who was fascinated by what we were doing, and they thought, well, if Bupa's investing in these types of services, how can we leverage what you're doing to support better social need and impact?
Which is great to hear. Hey, Sam, just saved about 30, 40 seconds here. You attend briefings at the Bank of England after monetary policy decisions. You've been consulted on the economy by a number of government departments. You are head of forecasting and thought leadership. Leaders, are they sensitive to this? Are they increasingly looking at factors like this that impact the economy, but impact really the well-being of their people? Just quickly.
Absolutely. And to return to a point made at the top of the session, I think this has increased markedly since the COVID-19 pandemic, and the way that completely uprooted traditional working practices. It's put mental health at the forefront of the office conversation, and I think that will only increase with time.